It's never been more important for medical technology innovators to work very closely with the patient community. As I discussed this morning, the innovation ecosystem in medical technology is under significant duress. Capital formation for small companies, venture investments down about 40%. First-time financings for small startups is down 75%. If you look at the regulatory process, we're making significant improvements, but it's still the norm for first products to be introduced in Europe and to be available to European patients and others for several years before American patients are. You talk about the reimbursement environment. We just did a study with Tufts University that showed it's 20 times harder to get a positive coverage decision from the Medicare program than it was just 10 years ago. And even if you get a positive coverage decision, more often than not, it's narrower than the FDA-approved indication. We didn't talk much about tax policy, but tax policy is also driving some of this activity offshore. So if your first product is going to be introduced in Europe, it makes more sense to do your clinical trial there. Maybe it makes more sense to have your manufacturing facilities there. So I guess in order to, just to step back and look at the ecosystem, we see significant challenges. So I think there's a great opportunity to work with the patient community, particularly on things like the 21st Century Cures Initiative, to identify specific proposals that would address these weaknesses in the ecosystem. I think specifically working on patient preferences and ensuring that patient preferences are more effectively addressed by the regulator. And as we move to personalized medicine and we get a greater understanding of how various technology interventions affect populations and subpopulations, I think it's absolutely imperative that the device center at FDA appreciate patient preferences, and I think they do. I think the challenge, and one specific thing that we might work on together, is looking at a more systematic approach for identifying or characterizing patient preferences so that regulators have more comfort in using those instruments to actually affect regulatory decisions. I think we're in the tale of two cities. In our space, you look at technologies that enable the deaf to hear, the blind to see, the wounded to walk again. It's tremendously exciting. And yet the ecosystem is under duress. So my message is we're really at an inflection point that we want to see continued medical progress, and we have to address the ecosystem together to ensure that we modernize the clinical trial structure, we address incentives for reimbursement, that we're addressing tax policy. Really, it demands a comprehensive approach, and we're hopeful that the environment in Congress, the advent of the 21st Century Cures Initiative, the President's proposal around precision medicine really creates an opportunity for the stars to line up and to make progress.